Hello everyone. My name is Amir. I'm the hematology registrar from uh, Yorkshire Deanery. I'm having sessions weekly for the FRCPath Part 1 at the Hematomorph Forum. Um, since I have gained a lot of experience in checking the assays, I have noticed few points that lead to um, losing marks during the part 1 exam. So I thought I should share these points with you in the video to avoid them in your part 1 exam and also in part 2 exam for FRCPath Haematology to to avoid losing marks, sorry, and to make your journey of FRCPath exam very easy. So let's start from the first point, that is the main contributor to the failure of exam, especially, is the lack of practice. Um, Lack of practice can be of two type. Some people are overconfident. They say that we will start practicing typing the essays by the in the last month of the exam, and then during the last month of the exam they are overwhelmed by many things and they do not get the chance to do the typing practice, and they face difficulty in arranging their essay during the exam time, and that's why they either write too much in the exam in one essay or write um, less content in the essay that leads to their failure. So if you have typing practice before the exam and if you have essay practice before the exam, then you will be well prepared and well managed to attempt the essays in the exam. So my advice would be that if you are planning for your next exam, you should start practicing essays from the beginning, at least one essay a week. We in our FRCPath Hematomorph Part 1 WhatsApp group, we practice these essays and we will be guiding you through your journey as well. Next point is that people are practicing essays, but um, not in a way that the examiner would like. Um, Maybe they have not attended any courses before the exam, or they are not guided by their seniors in the hospital. So their way of writing are different, which is a bit not acceptable in the exam. So if you are planning to appear in an exam, don't shy. Let your seniors check your essays, and they will make correction of your mistakes, and it will help you during the exam. The next point is the time mismanagement. Um, each question is for 45 minutes, but I asked my students to complete the essays in 40 minutes so that you have 5-minute grace period to recheck your essays to avoid any mistakes, because sometimes we think that we have written this information, but actually it is in our mind and it is not transcribed in the typing form. So um, start from the beginning to type your essays in 40 to 45 minutes. Yes, obviously in the beginning it will take more than that, but after attempting 5-6 essays you will notice that you will be able to attempt your essays within the time frame, and that is very important during the exam. Third important point that lead to losing marks in the exam is the irrelevant content. If the um, uh, question is asking you to write a principle of any test, write the principle of the test, not the whole procedure. Or if the question is asking you list the differential diagnosis, just write the differential diagnosis, do not explain them. So the examiner is interested in the differential diagnosis list only, not in your details. By writing details, you are losing marks. So read the question properly. If it is a 2 mark question, it means this question needs less content. If the question is for 12 marks, it means this question needs quite a lot of stuff. So writing 1 page answer for a 2 mark question and writing 2 lines for a 10 mark question is obviously harming you. Most of the candidates they think that if we write more, then we will pass the essay. No, quantity does not matter in the exam. It is the quality that's matter. Um, the examiner has a key in front of them when they are checking your essays. If you have mentioned the relevant things in your essays, they will tick box. If not, you will fail the exam, even if you have written the whole page. The next important thing which leads to losing marks in the essay is that the candidates do not address the patient in the question. The candidates answer the question in general. If your patient is having hemolytic anemia, severe hemolytic anemia, and he is symptomatic with that, it means he needs urgent blood transfusion. So if you say that if the patient is symptomatic, I will transfuse him. If the patient is not symptomatic, then I can wait for the patient and treat accordingly. So that is the wrong answer. You have a patient given to you which is in the scenario. You have to address the patient, not in general. That is a poor judgment. Then most of the candidate assume that the examiner is reading my mind. So they do not mention the common thing in the essays, like for example, consenting for the chemotherapy drugs and for the blood transfusion. They skip that part. If your patient is requiring blood transfusion and you do not mention consent, you lose a mark for that. So do not assume. You have to write everything in your essay. Then the next point, especially for the overseas candidate, is that they do not know the UK culture. They would use the word husband, wife, even if that is not mentioned in the essay. They are not familiar with the word partner, um, and such things usually leads to losing points in the essay. Be familiarize yourself with the UK culture. That is an important aspect of the exam as well. The next thing is the not knowing the LHS function, like how it works. We have MDT set up. We have different functional bodies here, like NHSBT, RCI labs, um, safeguarding teams, psychology team, physiotherapy, occupational therapy, socioeconomic services, etc. And the in case of children, child safeguarding teams as well. Short Mahra, we should know about these things when we appear in the FRCPath Part 1 exam for hematology. The next important thing is which leads to losing marks in the exam is that the candidate do not address the urgent needs of the patient. If a patient is in sickle cell crisis and you are asked to manage this patient, you do not start with the history, you start with addressing the patient pain first. If the patient is bleeding severely and you are asked to how would you manage this patient, you do not start with a history, you have to address the patient bleeding first. When he is stabilized, then you would uh, then you would manage the patient. Okay. The next important thing which leads to losing marks in the exam is the lack of difference between treatment and management. Treatment is a part of the management which include just the uh, chemotherapy or non-chemotherapy drugs or procedure like plasma exchanges, red cell exchanges, etc. While management include history, examination, investigation, consultation with the patient, treatment options, and follow-up. Next point is the spelling mistakes. The common spellings that we use in our daily life, if you write them wrong, that usually annoy the examiner, and it may change the meaning of your sentence as well. So try to avoid spelling mistakes in the um, exam. And some people have a habit to make self-made abbreviation. Use the standard abbreviation for the um, during the exam, not self-made one. Yes, chronic lymphocytic leukemia (CLL) is a standard abbreviation. Waldenstrom macroglobulinemia, now WM is a standard abbreviation. But if you use something else, then which is not understandable to the examiner, then it can lead to deduction of marks. Next important thing which lead to deduction of marks and considered as a poor judgment is the incorrect place of the information. Um, for example, uh, you have a management question and you have mentioned all the treatment options for the patient, and after that you say that I will consent the patient for bone marrow biopsy, or I will do CT scan for this patient to find out this one. So this is a wrong place of information. Uh, Investigations or procedures comes before treatment. So you should write in an order that you will clinical history and examination, then investigation, then consultation with the patient, then treatment option, and then follow up. If you mix the things, then means poor judgment. Next one is the unable to recognize the hematological emergencies like APML, hyperviscosity syndromes, TTP, etc. If you think that these are the diagnoses and you first mention that I will do these tests, that test, etc., and which lead to delay in the patient intervention, obviously your patient will be affected, and this will affect your exam and essay as well. So whenever you see an APML patient, mention quickly that this patient needs ETRA as soon as possible, or if it is hyperviscosity, then this patient needs plasma exchange. If this is TTP, need discussion with TTP consultant. Okay. Then in management of pregnant patient, usually the newborn is missing in our essays. Newborn or the baby is a part of the pregnancy management of any hematological disease. You must mention with a heading baby or a newborn what to do with a baby. In some questions, in management question, follow-up is missing. So if you have diagnosed the patient with DLBCL, for example, and you have started treatment for him, so after the first cycle of treatment in the hospital, what next? You do not abandon the patient. This is your patient now. You have to arrange follow-up for the patient, and you have to arrange blood test and give him cards, etc. The next important thing which leads to losing marks in your essay is forgetting consent. If you have a hemolytic anemia patient and that is requiring blood, we don't know whether this patient has previously received blood transfusion or not. This may be his first time. So we should not assume that consent is taken, or the examiner will know that I will consent the patient. No, you have to mention blood transfusion after consenting. He may be a Jehovah Witness, or he may not be a Jehovah Witness, but he would say, or she would say, I do not need blood transfusion. I do not want blood transfusion. He will refuse, or she will refuse. So consenting for blood transfusion, consenting for chemotherapy, just mentioning the word after consent is enough, but you have to mention consent. This is our routine practice, but in the exam situation we are under stress, so we forget it. Then certain situation needs irradiated blood. We manage the patient with blood transfusion, but we forget that this patient would need irradiated components. So that is a mistake which can harm your essay. Then next point is unfamiliarization with some arrangements or intervention that takes time. For example, if we have a patient of Glanzmann's thrombasthenia and we mention that this patient need HLA matched platelets for bleeding, he is in the A&E and he is bleeding, and you say that I will give him HLA matched platelets. HLA matched platelet arrangement takes few days. You will give him random platelets. And secondly, if you have acquired hemophilia patient and if you have an elderly patient who is bleeding and you are suspecting this is acquired hemophilia, then we cannot say I will give him Obizor for the acute bleeding. We need to test the patient first for porcine inhibitors. If no inhibitors, then we can give him Obizor. But testing for porcine inhibitors takes some time. Then for getting pregnancy test for a young female in our essay is a common thing which I have noticed. If you are given any female of childbearing age potential, it means that the examiner would expect that you would mention pregnancy test in the answer. So make a habit of writing pregnancy test if you see that the patient is a young female of childbearing age potential. Next important thing is the fertility preservation. If your patient is a young adult and in patients who are male, even if they are elderly, and we are giving them immunomodulatory drugs like lenalidomide and they are in 80s, we know that they do not have any plans for family, but we have to mention that this drug need discussion regarding fertility preservation. And in young adults, yes, they need discussion regarding fertility preservation because chemotherapy may affect their fertility. Next thing which I have noticed that uh, people are missing in their essays is the registration of the patient. The most important example is the bleeding disorder patient. If you are managing any new patient with the bleeding disorder, we forget to manage this, to register this patient with the comprehensive care center and with the national bodies, national hemophilia registry. So you can lose a point for that if you do not mention in the exam. Cards are very important in the management questions to mention. Patient may need antibody card, irradiation card, CNS card, or there are many other cards, chemotherapy cards, that need to be mentioned in the management question as well. All these cards carry marks. You have to mention in your essay. Then, if you are doing transfusion question, your mind should click whether this essay needs short or Mehra referral or not. Writing whole essay and about transfusion reaction, but in the end you forget short and MHRA, so you will lose many points for that. Okay, and it may harm your essay. So whenever you are going for transfusion essay, think about whether this question needs short and macro referral or not. If you are doing a coagulation question, patient is a bleeder, think whether this patient would need um, bleeding disorder card, registration with um, uh, comprehensive care center, etc. Um, Trials, if you do not mention it, it will not be a harm, but if you mention the names of the trials, it carries a positive point, a good impression. So basically, this was the list of almost 25 points that I have noticed by after checking the essays for many months now, and I thought I should make a separate video about that, um, so that you are aware about that before your exam. The exam is near. For this exam and for the other coming exams, um, I would say write these comments, these points in a bullet point form on the paper, and paste it on your study tables or the front of the PC, and go through it uh, once in the morning if you are going for the exam in near future. These are important for FRCPath Part 2 as well, because you will be dealing with the same things in FRCPath Part 2 exams, but with a different format. So you should remember all these points, and try to make a mnemonic of these things. I have already made one mnemonics, and it is shared in our FRCPath Part 1 WhatsApp group, and you can use that one as well. But that one is mainly addressing the management question. These points that I have mentioned are a lot more. If you can kindly work on that before your exam, it will help you a lot in passing your FRCPath exams in the first attempt. Thank you, and you can contact me via Hematomov YouTube channel, or you can contact me via WhatsApp as well. Now we have a lot of candidates. I think all the people listening this video will be a member of our FRCPath community, Hematomov community. You are welcome to contact me anytime. Thank you. See you later.